Well, good afternoon, everybody. What I'd like to do is talk about where I think the NHS is and where it's likely to go and the problems on the way in the next year. And so the obvious question is, where do we start from? And in a way that I think is relatively easy, perhaps one of the few things we'll find a consensus on, that most people recognise that the NHS is in a pretty poor state at the moment. And even the government, which has been in some denial about this in the past, has recognised this in the last year and made what many see as an epochal commitment to invest in it in the future. Again, we'll come back to whether and how quickly we're going to see a difference because of that. So what we've seen is an admission and a change in attitude, but the reality on the ground has not changed at all. And the last year has seen the NHS get worse, struggle more, most vividly, most viscerally in the struggles over last winter, which saw the NHS not coping in many respects with serious waits for treatment for people seriously ill. And although it is impossible to be sure of that, I would suggest that the statistics that we have suggest that some more people will have died because of this. The rate of reduction in death rates has altered, and the hospital discharge death rate has increased. And I have previous experience managing hospitals where you can alter that death rate by doing things better. So when, and this would be about 10 years ago, we realised how bad the problems with infections in hospital were, and a programme which took 4 or 5 years really to get on top of, definitely reduced deaths in hospitals. It was as simple as that. And you could see the curve shooting down. And I'm afraid it started to shoot up. And the explanation has to be that we're not treating the most seriously ill quickly enough and effectively enough. So not only that, or rather one has to look at why that is, and lack of resources has to be the key explanation. This year we find the NHS under-resourced, and I think that now is largely common ground. But the explanation for it, and the key here is really important, is not common ground. The commonplace explanation, I think the one grasped by authorities, government, and I think often those managing the NHS, is that it's ballooning demand. It is not. Demand has been rising predictably, modestly, and consistently, but it has not ballooned. The problem is that the supply of resource and the supply of people has not matched that modest increase. Had it done so, it is my view, and I've written to this effect, and I think demonstrated it, we wouldn't have had this crisis. So modest but regular increases in line with demand would have avoided the crisis we have. And this again is a key to what needs to be done in the next year and beyond, in my opinion. So not only have we had a lack of resource, that's led because people have not been investing enough in training enough staff and have been unwilling to take on new staff. So we've actually had a snowballing effect of insufficient staff, which has led us into something of a downward spiral. And now the lack of staff has become a problem in itself. Even if there were enough money, we couldn't get enough staff in the short term. And that again is a problem we've created by turning organisations on themselves, and that needs to be turned round for the NHS to prosper again. And what have we also seen? An increase in the number of things going spectacularly wrong if you like, the big scandals, and we've had one in the last week or so. There's been reported the Shrewsbury, Telford one. These are increasing. The CQC is continuing to find these and more of these. And the CQC itself is saying, look, this is an overstretched NHS where things are going to go wrong more. And I predict they will find more things going wrong. If you haven't got enough, you start to overstretch and you make the wrong compromises. So the other side, I guess, is the positive side, and I don't want to sound too churlish. Many of us have been saying the money's been needed for a long time, and we're finally getting a promise of some, but we haven't got any yet. Person who, I don't know if he'll go down in the NHS as a great Secretary of State, but I think he'll go down as a much better one than his predecessor. And I think it's Jeremy Hunt's realisation that the NHS really did need extra resource that was a key in turning round the view of the government, and in particular of the Prime Minister and the Chancellor, who I think had little or no sympathy with the view that the NHS was underfunded. And famous meetings where Simon Stevens was excoriated only about a year or so ago, you know, for not getting everything in order, with him having said that was going to be enough resource. But Jeremy Hunt, I think, has been instrumental in turning that round. However, the other obvious point to make is Jeremy Hunt's no longer there. So, if you like, the voice of understanding, perhaps, in government of what the NHS needs is no longer there, and we have a new Secretary of State. So I think that's roughly where we are. So what's going to happen in the next 12 months? Well, certainly through this winter and at the beginning of next year, no more extra money. There is no more extra money coming in. But so the NHS is being asked to manage on what everybody knows is an inadequate resource, cannot change its policies. Managers are still being sacked, above all, for overspending. So it is a brave and foolish leader who spends money he or she doesn't have. So the reins are being pulled very tightly, and we're facing, surprise, surprise, winter. And I think there's every reason to think that this winter will be at least as bad as last year's, from a healthcare point of view, which was much worse than the year before, which in turn was much worse than the year before. And it may be that we will struggle through it, but it may be things will get much worse. And the other confounding factor that needs to be there in the balance is that it's not just health. The pressures on social care are as great and probably greater than they are on health. But because they are Siamese twins here, the pressures on social care, if they're not dealt with, do lead to healthcare failing to do its job and wasting resources. And for me, the nexus of waste resources is that interface. Because social care can't cope, it doesn't take on the responsibilities it should from health, which help health in some ways, you know, is left holding the baby, but does that really badly, really expensively, at the expense of doing other things well. And this has been going on for years and years. I can remember seeing this when I was in West Hertfordshire, round about 2009, 10, 11. And I worked out then that we as an organisation were wasting at least 1% to 2% of our budget because of that dysfunction, and possibly 3 or 4%. And that was a waste because of this blockage between the two organisations. I would bet it's double that now. So this is a waste of money because two organisations strapped cannot cooperate together. Two parts of the equation. And that will not change this winter. And again, we await in the next year, let's get on to that, the 10-year plan that the government has asked the NHS to provide to say how this huge dowry of money is going to be spent over the next several years. And I don't want to be too much of a downer, but I am a pessimist about this in many ways, because unless the social care problem is completely interfaced and interlocked with this, a lot of the money will not be able to be used properly. The two must be seen together, and above all, the blockage of patients stuck in hospital who need social care, who do not need acute health care, needs to be solved for social care to work properly and for health care to work properly. And I believe that needs to be the number one problem that the 10-year plan says we're going to solve. I doubt if it will be, but I really hope it will be. So we await that with great interest. And again, I have to express some pessimism because, again, I don't think the government, other than Jeremy Hunt, had got really what the problem was. It was, oh, we're going to put some money in, the problem will go away. And I remember the Labour politician who most got that wrong when the NHS ran into problems in the middle of the Labour period when they put in huge sums of money. And I remember John Reid saying, we've given you the money, now do the job. And what he meant was, we've given you a lot of money, and what he should have said was, tell us what you can do with that. But he assumed, we've given you a lot of money so you can solve everything. Of course you can't. Demand and supply need to be matched. And there is a lot of money, but there's a lot of shortfall. And in my view, the key is the shortfall must be resolved first. And the problem has been, and I'm afraid the current head of NHS England may have a track record on this, that he was party to a very ambitious plan the Labour government set up. I can't remember what it's called now. I think it was an NHS plan, but it was actually a party manifesto, and it didn't fully take account of the need to sort out the existing problems. And the 5-year plan which Simon Stevens set out, again, ignored and didn't foresee the fundamental problems the NHS has had over the last 3 years. And had it done so, I think we could have avoided getting to at least some of the bad places we're in now. So I think it was Einstein who said, you don't solve the problems of the future by asking the people who created them to come up with the solutions. And I have a worry that we're doing that at the moment. So what else do I think? I suppose the other thing is the big B word, Brexit. None of us know what's going to, I certainly don't know what's going to happen, and I get the impression no one does. But it is the overwhelming issue. And I guess nearly everyone was, for God's sake, sort this one out, please. But the problem with that is that there's very little high-level attention to solve anything else. And that includes the NHS. The NHS, which needs a lot of political input and high-level thinking about how to get it right, and indeed how to use this investment, in my view, is highly unlikely to get it. And it's slipping below the radar screen. And it should be right up there at this point. So I think that makes it more perilous. And I think the NHS problems, the government's hoping, we'll put some money in, it'll go away, we've shown a declaration of intent. Well, it may in the short term. But if there's a really bad winter, it will come up and slap them in the face. And if that's at the time of, maximum difficulty over Brexit, what on earth's going to happen then? And also, say one possibility is we'll have an election or a referendum. The NHS will come up the agenda. What does this mean for the NHS? And if we get a no-deal Brexit, and everyone suggests the economy is going to be hit hard, isn't it likely that Philip Hammond, if he's still Chancellor, will say, sorry, that money we promised for the NHS, that's on hold. So it's really important. I realise we're not the drivers of that, but it's really, really important. And I'm very fearful. I think that, that there are other consequential things which of themselves are not going to be central to the Brexit debate, but I think the fact of medicines through and drugs through the EU, I don't believe we won't get them or anything. I think that's nonsense. But I think we may end up paying more for some of them. So the budgetary impact on the NHS may be bad. And there are other little things, when it gets to the crunch, it's not the NHS as such, but most of us, and I carry it around with me, my EU card for treatment when I go abroad. When everyone realises next summer they're not going to have those, wow, isn't that going to cause a lot of bad feeling? And probably a good time to invest in travel insurance companies. But for the rest of us, not so good. And things like that will impact. So that is the next thing. I think the other thing to say is more of the same, in my view, means we haven't yet got rid of the legacy of the Lansley reforms, which I think are some of the most disastrous reforms the NHS has had. And I think, I suspect, someone like Jeremy Hunt, who's been trying hard, and so has Simon Stevens, to segue around them, would also agree, but they're still there. And we have a balkanisation of the NHS, which means it's going off in 1,000 different directions at once. And some attempts to bring that together without the power to do so. And I think that will remain a major problem in the next year. And also it means that the people supposedly at the top are actually completely operationally disengaged. Simon Stevens has been completely operationally disengaged from the operational problems of the NHS. Why? Because he has no power to do anything about them. Why? Because he has no responsibility for them. But that's not admitted. The narrative of the NHS to the public in the media doesn't accept that. So there is denial and a degree of delusion in that. And that needs to change. And again, there's no immediate sense that it will. So what's going to happen in the next year? As well as a bad winter, social care getting worse, waits for elective treatment suffer as a result of that. We now have more people waiting than we did before the Labour investments for operations. That is going to get progressively worse. It's not going to get marginally worse, because once you are no longer matching supply and demand, you go from level, you shoot up. And we saw this in the past when we had those problems. And as manager, you saw it till the point at which people think, I'm waiting 2 years. I'm not even going to try and have an operation. I'll either do without one or I'll go private. And we're heading into that territory. Whether we'll get into it overtly next year remains to be seen. But those weights will go up inexorably until and unless, the investment of the 10-year plan says the first thing is to put right those immediate failings. And my worry is that a lot of the 10-year plan, as the 5-year plan, was to be ideological and to say, if only we stop people going into hospital, treat everyone in the community, the problem would evaporate. If only we centralised everything, we'd do things, the problem would evaporate. It won't. Some of those things may help, but you have to solve the existing problems and then think about other things that can help. And I think a lot of the leadership of the NHS, because it's been feeling an impossible position, has looked for solutions that aren't there. And in doing so, ignored what it could do about the problems that are there. So, having said that, I do want to say I am not, there's Brexit and there's Nexit. Nexit being we don't want the NHS. I am not an Exeter. I believe that the NHS is the worst possible health system in the world, except for all the others. as Churchill said. But I am worried that in this government there isn't an NHS champion anymore. It's seen as a nuisance. They wish it would go away. And Matt Hancock, I hope he'll be good, but his background suggests no particular interest in the NHS and association with, I think it's the IEA, who have been, you know, how do we replace the NHS with an insurance-based system? Now, he may not go down that road, and I hope he doesn't, but the NHS needs its champions, and that has to be a worry in the next year or so. I think that the NHS plan needs to address getting demand and supply into sync, which means paying the true costs of what you agree you have. Instead of saying, this is the money, do everything. What you have to say, this is what we want to do, we'll now get it costed up. If that costs more than we've got, we'll tell you which things not to do. And policymakers, government and central management have to take responsibility for that. If they do not, the crisis will recur. Just one or two other points to make. In terms of other things that I think have been failures from the Lansley reforms, the commissioners, a layer of people commissioning, have become, in my view, an almost complete irrelevance when you have a managed system with effectively monopoly suppliers, hospitals. We could save a whole layer of bureaucracy. And I think that's what Simon Stevens believes and is trying to move towards, but we ought to get on and do that. It actually obscures and makes opaque what we're trying to do. I think the one thing the NHS and many of those who criticise it say our death rates, particularly for things like cancer, are worse than many other European countries. What we're bad at is early diagnosis. And that's where we ought to invest money in. If we got to problems earlier, we would stop them getting so much. But that's not just saying, oh, we'll shove everything into the community. That's expert early diagnosis. People presenting with cancer at A&E, particularly in London, but elsewhere, is very high, and people present with advanced cancer that's largely non-treatable, but massively expensive. And part of the problem is an overwhelmed GP workforce and lack of specialism in primary care. Primary care system has massive advantages, but its lack of specialism and that it is overwhelmed leads to later diagnosis, and again, this is dysfunctional. It's a waste of money, and even more importantly, it's a waste of human life. So that's one of the things that I hope the 10-year plan will do. So I think the time has come probably to draw this to an end. I think in the short term, I think we're going to have a hard time and a rough ride, and I think the preoccupation with Brexit makes that worse and more likely. I think there's a chance of starting to get into the sunny uplands, but not for another year or so, and that depends upon some very hard-nosed, realistic admissions of where we are now and what we need to do to get sound footing. Thank you very much.